Welcome back. Well, the Victorian government has just launched the largest ever public health campaign in Australia against vaping and nicotine addiction. New research shows that young people are at risk and taking up vaping, having never smoked a cigarette. Joining me live now is the Cancer Council Victoria CEO, Todd Harper. Thanks so much for your time. Talk us through what you're trying to achieve here.
Thank you. So this new campaign will aim to bring some of the facts about vaping and particularly the contents of these products and provide that information to consumers. We haven't seen that information be provided by the manufacturers or the retailers, and when so many young people in particular are taking up vaping, we need to be doing everything that we can to provide information to them about the harms of these products, the ingredients, and also provide some support to parents who are doing it tough at the moment, trying to inform their kids and make sure that they reduce the chances of children becoming vapers into the future.
There are plenty of people out there that say, you know, vaping's not that bad, but I don't ever think there's a delineation between the prescription model, which is not the problem here. It's those flavoured, disposable vapes that are manufactured overseas. There's a distinction, isn't there?
Absolutely, and that's the problem that we have at the moment, is that on the one hand we've got that opportunity for people who are addicted to tobacco to obtain a prescription under medical supervision in an effort to quit cigarettes. But what we are seeing is young people taking up these vapes in huge numbers. We know that people who use e-cigarettes are 3 times more likely to go on and become smokers. Our biggest concern is that unless we get ahead of this problem, we'll actually start to see smoking levels in Australia rise again. After everything that we've been through as a country to get tobacco smoking levels down, we really can't afford that to happen. So campaigns like this are really important.
Yeah, they are, and it's only in Victoria. They probably need to be nationwide for them to be really effective. But coupled with what different states and territories are doing, but also the federal government, and most importantly, trying to ban these vapes. We know that prohibition doesn't always work. How much faith do you have that all those, that multi-pronged effort from the federal government's perspective is actually going to work?
I think that that federal model is really important to give parents and young people a fighting chance. It will also make it much easier for law enforcement agencies at state and federal level to enforce those laws if we can get on top of the terrible situation we have with cheap vapes flooding into the country. So this is a campaign that will, I think, be the first of its kind in Victoria. We'll see more of these types of campaigns rolling out nationally. Much like we did with tobacco, we're going to need an effort that includes education campaigns, ensuring that we're getting the public health messages out, restricting access, particularly to young people, to everything that we can to get on top of this problem.
No one really could say for sure. I mean, we know some of these chemicals in vapes, but it also seems to me that there's not enough research being done on some of the contents and what the perverse health outcomes might be in these disposable vapes. Are you concerned about that?
It is a good point. We do know that testing has shown that there's more than 200 poisonous and toxic chemicals in these products. And we also know that many of them include heavy metals and even carcinogens. Our lungs were never designed to inhale those types of products. But the point that I would make, of course, is that many decades, four decades after the introduction of factory-made cigarettes into Australia, we were still discovering some of the long-term harms of tobacco use, decades after they were introduced. I don't want us to be in the same situation with vaping and discover in future decades long-term harms emerging because of these products. Given that these are being inhaled into our lungs, we need to be very careful about ensuring that we're not creating a generation of future addicts and that we're not creating a future generation of disease that is attributable to these products. We need to be very careful about chemicals like this being inhaled into our lungs.
Do you think it might be too late on both of those fronts?
I'm really optimistic that with the introduction of the bans on federal importation and the take-up of campaigns like this, together with removal of some of the bright candy-appearing packaging and some of those flavours, that we actually can get on top of this problem. And we need to remember that this is the country in the world that led the world when it came to smoking. I think we can do the same with vaping, and the future of our young people absolutely deserves that opportunity for us to do that properly and be successful in this endeavour.
Absolutely. Todd Harper, thanks so much for your time today. Appreciate it.